Ask Dr. O. Trustworthy, competent, confident, professional, honest, focused, intelligent, disciplined, real answers to real questions. A healthy mind is a healthy body. Ask AskDrO.com.
Hello, good morning, good afternoon, or good evening, whichever one pertains to you. This is a very, very important month for us. It's called the Breast Cancer Awareness Month, and we've had a number of interviews, and today I am here. I'm so excited. I'm here with my Spelman sister and a renowned breast cancer surgeon, that in the person of Dr. Anita Teresa Johnson. Welcome, and how are you doing today?
I'm doing great.
Well, you know, this is a month that we've had the opportunity to do a number of interviews, and I just find that it's so important to really get the word out to a number of our readers, our listeners, and those that come on the blog about breast cancer. Do you still see this as an issue today in our communities?
It's a major issue for all women, and specifically African American women, because they present at a later stage, although they can present at an earlier age. And sometimes the reason is because they're misdiagnosed initially.
Okay. Now, Dr. Johnson is one of 3 fellowship-trained breast cancer surgeons in the Atlanta area. It is an honor to have her here with me. Now, as I was thinking about this problem, I'm working on a fundraiser. Is this still a particular issue in minority communities?
Very much so. Today, African American women are not screened as regularly as our Caucasian counterparts, and therefore they're diagnosed at a later age. There are some socioeconomic issues that may be a problem, as well as lack of insurance.
Okay. Now, without breaking any HIPAA, can you tell us about one of the cases that probably most disturb you or keep you up at night?
Well, recently I saw a 70-year-old African American woman in which she's had a lump in her breast for 17 years. Had a primary care physician, unfortunately, did not have a breast exam as well as a mammogram during that time. When she presented to us, it was obvious metastatic disease. And I performed a biopsy on her in the office, did some additional testing, and unfortunately she was stage 4. What this means is that if she presented to us earlier, we could have done a less invasive procedure for her, as well as she possibly had the option of not needing chemotherapy.
Now, that leads into my next question. I mean, in the past, all we know about is chemotherapy and the hair falling out, the nails falling off, and a lot of secondary side effects of the chemotherapy. Are there any new treatments now for breast cancer?
There's several new treatments. One of the latest treatments includes, surgical treatments includes nipple-sparing mastectomy, in which we make an incision just below the breast, and all the breast tissue is removed, and the plastic surgeon comes in and places a temporary implant. This allows all the skin of the breast tissue to be present, as well as with a great cosmetic outcome, as well as great surgical margins.
That is excellent, and that's something that a lot of you out there may not know about, and that's why we're coming here at AskDrO.com to give you some of those new and cutting-edge treatments. Now, Dr. Teresa, as I call you affectionately, you've done some publishing. You've written a couple of articles. Tell us about one of those articles that you got a lot out of.
I've actually was one of the first breast surgeons to publish on minimally invasive breast biopsy, in which the breast biopsies are performed in the office and the woman can go home with a Band-Aid. The paper's been published for several years, as well as I've published some papers on intraoperative surgical management.
All right, I've enjoyed having you here with me, Dr. Johnson. This is Dr. Johnson, my classmate from Spelman, who's proprietor of thebreastcareteam.com. So tonight, if you have any more questions, want to know a little bit more about this very close subject to our hearts, go to www.thebreastcareteam.com. Now, Dr. Johnson, we're about to go, but can you tell us how to reach you if we need you?
Well, I'm located in Atlanta. We have 2 offices, one in Atlanta and one in Woodstock. We're located off of 960 Johnson Ferry Road. The office is 678-445-0976, as well as our website is www.thebreastcareteam.com.
We want to thank you for tuning in. This is Dr. Owens with AskDrO.com, where we believe that a healthy mind is essential for a healthy body. Thank you and enjoy yourselves.
AskDrO.com.